My name is Dr. Randa Elmallah. I am an orthopedic shoulder and elbow surgeon here. I trained at the University of Mississippi in Jackson, Mississippi for orthopedic residency. And then after that, I did an additional year in subspecialty training at Harvard up in Boston, Massachusetts. I do everything related to the shoulder and elbow. So from a surgery standpoint, this includes arthroscopic procedures, rotator cuff repairs, anything to do with shoulder replacements, revisions of shoulder replacements, and then in addition to that, a lot of preservative management for the shoulders. So for patients who are on the brink between a shoulder replacement, I usually am the person that does all the salvage procedures, including the tendon transfers, before they reach that point. I like the variety in my work. It's really nice because not only do I do the elective bread and butter shoulder replacements, the arthroscopic procedures, I also cover a lot of the trauma of the upper extremity. I deal with the proximal humerus fractures, any breaks pretty much along that area. So it's really nice because no day is the same. I see all sorts of different pathologies. I love interacting with different patients. You know, I deal with very young patients, I deal with old patients, so I really like being able to see all sorts of things. I chose orthopedics probably early on in medical school for several reasons. I like working with my hands. I like anatomy, so I really like anatomy of the upper extremity specifically. I really enjoy, it's a very gratifying field. You can usually identify a problem in a patient and fix it, and they usually get better right away. So I really like that aspect of it. When I was looking for jobs, I looked everywhere, but the main reason I came here is because my husband lives here. So we obviously wanted to be together at that point. But Cox as a facility is great for me because it provides me all the resources I need to deal with everything that is super complex if I do see it. In addition, it's very easy to center my care around patients. So there isn't a lot of extra fluff in terms of the administrative side that I have to deal with. So it's very easy for me to see a patient, you know, focus on them, decide what's best, and then be able to carry out that step. You know, I love the outdoors. Me and my husband love going hiking. I like to work out in my free time. And then we love to travel. So usually we try to pick a different destination each year to go to. And then honestly, in my downtime, my favorite thing to do is just spend time with my family.